Hi everyone, I am Saranya, Assistant Professor from SNS College of Allied Health Science. Today we are going to see a topic on incision and its types. I am going to describe this topic in a DT based manner. What is incisions? Incisions are the surgical cut down on the skin to facilitate the operation so that we can able to visualize the organ, we can correct the abnormalities in the organ. It helpful for easy accessibility, extensibility and security during the surgery. And in this image, I have given the different forms of incision in the body, which are subcostal, paramedian, midline, McBurney, phalansteal, and transverse. So, before going for an in detail about each incision, I am going to give you a case study. A 35 years old woman who suffers from an emergency appendectomy. She had a pain in the appendix. Her primary concern is having a minimal scarring and quick recovery from the surgery. Her surgeons might wait cosmetic outcome with surgical access and safety. So what are the things that each and everyone should notice for this operation is, as a patient, what I feel is desires a safe operation and a good cosmetic result and with minimal scarring. What is the surgeon's need is to give a best exposure while preserving the function and appearance of the tissue. What could be the expectation of the family is they want an assurance about the risk and the recovery phase. So all this should be keep in mind before going into a case. So these are the expected things to be done in a case. So this is my emphasizing a stakeholders' concerns. So what could be the definitive principles of an incision should be? An ideal incision should have an adequate exposure to the organs. I have to visualize the appendix a well manner so that we can able to incise, cut it down and remove the affected appendix part easily. Ensures a clear visibility and a good surgical procedure to be in a proper way. Align with the Langer's line. Langer's line is a body's alignment. This alignment helpful for a proper healing of a tissues and tendons, whatever. And minimizing a trauma is very much more important. Reducing a patient discomfort is also a manner. And preserving a nerve and blood supply. To make an insertion, if you follow properly in the Langer's line, it will make a proper tissue viability and the function will be maintained. So what are the anatomical consideration to be done? A small insertion which can be made on the skin surface where the organ can be visualized after these much of layers. You can first incise the skin, subcutaneous tissue, muscles, fascia and the peritoneal. It is a layer covering of an abdomen region, and then only we can able to visualize the organ small intestine where it has a small tile like structure called as appendix. What are the common types of incisions we know? We know as a midline incision, paramidline incision, oblique incision and transverse incision. In this image, I have given the first image is about a midline incision in the neck region, and the adjacent to the umbilical region is called as paramedian incision, and you have a McBurney incision as a cross symbol which is given on the image, and you have some other incision called as a Kocher's incision or a subcostal incision at the last image. And here are the certain special incisions are present to visualize the particular organ in the body. You have an Kocher's incision or a subcostal incision which is mainly useful for the surgical terms in the gallbladder and the liver. Chevron or a rooftop incision is an extension on the upper abdominal access. Mercedes-Benz is a symbol-like insertion which is a bilateral Kocher's with an upper median midline insertion for a hepatic surgery cases. Phalansteal incision or a Maillard incision is mainly for the cesarean and gynecological procedures. Thoraco-abdominal surgery is a combined activity of the thorax and the abdominal surgeries, like you have an abdominal aorta or a thoracic aorta aneurysm or the major cases. And what could be the factors which influencing a surgical insertion? It always depends upon the emergency or elective procedure, and the cosmetic consideration depends upon the patient. Surgeon's preference is also a matters for proper incision, and his skillful is also a matters. And the patient's anatomical status, how the previous scar is present or how the injury site is looking off. and how much of exposure is needed, whether we are exposing only the subcutaneous or we have to even open the peritoneal to view an organ, and the surgical site, what is the located target site of an organ or a structure. All this will influences the surgical incision. And what is the exact incision was made to this patient, and how can this incision selection process is done. Okay, so first one is you want to identify the target region where the appendix is present. Okay, focusing the pinpoint and the target region surrounding the appendix and it nearly to the groin region of your body. And the multidisciplinary conferences, like surgeons will meet among themselves and the anesthetists to combine and to give a comprehensive plan to do the surgery, and consider the patient factors like age, cosmetic priorities and whatever. And before going for a surgery, the incision site will be marked, and you want to get a consent from the patient as well as the patient attenders. So what could be the major incision which is taken for this patient according to the case study, which is emergency appendicectomy, is McBurney's or a Lance incision. You can see in this image. So this insertion will give a better cosmetic outcome, faster healing, and the location will also be proper, and the incision will be 2 to 4 centimeter, which is easy for us to do one suturing. And outcome of the patient, you can see a small scar on the patient body. This is the major reason for an cosmetic surgeries, and you have advanced technologies like laparoscopy nowadays to minimize this scar even can also be minimalized. And what could be the summary of this topic what we have discussed till now is, it is an incision, it is a surgical procedure to operate and to do an surgery. And what are the types of incision? We can go as a midline, paramidline, cochlear, peninstil, malar, chevrons, thoracoabdominal, subcostal are the different forms of variations of incisions are present. And what incision we particularly selected for this patient is a McBurney incision for an emergency appendicectomy. These are my references. Thank you for listening.